Let's talk about this for a second, because this is a concept that is really, really often confused by people in all different aspects of healthcare when you find out that your patient got a stent, even for people who work in the cath lab. So tune in. What are the drugs on the coronary stent, on the newer generation drug-eluting stents? So the options were antiplatelet and anti-immune, anticoagulant, or anti-proliferative and anti-inflammatory. The answer is anti-proliferative and anti-inflammatory. The Olimus drugs, if you're talking about the ending, that is what they are. They're an anti-proliferative and anti-inflammatory drug. And the reason is they're trying to aid in the healing process. So they're almost slowing the healing process down. And the reason for that is so that you improve the way in which it is healing. So it doesn't heal too fast. We don't get overgrowth of the intima, overgrowth and overproliferation of those cells that leads to in-stent restenosis. So that's why we have the drug-eluting stents. They're not anticoagulants and they're not antiplatelets, and we will talk about why next. What medication does a patient need to be on after receiving a stent? So the answer is antiplatelets. It's not antiproliferatives because that's what's on the stent. Remember, antiproliferative, anti-inflammatory drugs, so they won't need to be on those. And then anticoagulants. Now, if they have some other condition like atrial fibrillation or stroke prevention, they might be on anticoagulant, but it's not related to the stent. They need to be on oral antiplatelets. So you would have aspirin and then a combination of something else, Plavix, Effient, Brilinta. And the reason is now you have, remember, the slower healing process to get optimal healing. So during that time, these stent struts are exposed and there's blood going through there. So naturally, when you have a non-smooth surface, it's going to aggregate platelets. So what you want to do is prevent those platelets from aggregating onto the stent and causing in-stent thrombosis. So the patient will need to be on dual antiplatelet therapy, which is usually two different antiplatelets orally, aspirin, and a combination of one of the others. It is not anticoagulants because the reason we talked about, right, that's for stroke prevention for some of the AFib patients. But the patient does get anticoagulant, but during the procedure, not after the stent is implanted. We give heparin or Angiomax during the procedure while we are intervening inside of the coronary artery because we're putting wires, balloons, and stents down, and we don't want the patient to coagulate during the procedure. So we will put them on anticoagulants, which is stronger in the process of the clotting cascade than the antiplatelets, which are just preventing the platelet aggregation afterwards.